Keep your brain's drainage pipes clean to prevent aging and Alzheimer's disease. Aging is a major risk factor for the development of neurodegenerative diseases, including Alzheimer's disease, Parkinson disease, frontotemporal dementia, and amyotrophic lateral sclerosis. Abnormal buildup of misfolded proteins is a central histopathologic hallmark common to each of these neurodegenerative disorders. Despite increased understanding of the pathways involved in protein aggregation, the search for an initiating pathogenic event shared among such different disorders still continues. Fluid balance, protein homeostasis, and immune surveillance are some of the essential physiologic functions carried out by lymphatic networks which extend throughout the entire body, except in the brain parenchyma. In the absence of its own lymphatic system, the brain parenchyma is dependent on paravascular, glymphatic, roots and the recently rediscovered meningeal lymphatics for removal of metabolic waste and toxic metabolites. While both excretory pathways utilize cerebrospinal fluid as a sink for metabolic waste, little is known all about the physiological and pathophysiological interactions that exist between them. The glymphatic system represents a brain-wide intraparenchymal pathway which mediates clearance of brain metabolites via circulating interstitial fluid, CSF exchange, functional waste clearance pathway for the vertebrate central nervous system. Natural aging has recently been shown to affect peripheral tissue lymphatics as well as normal interstitial fluid, CSF circulation, leading to impaired glymphatic clearance of misfolded proteins from the brain parenchyma. These findings suggest a domino effect, whereby age-related impaired glymphatic clearance of misfolded proteins such as amyloid beta leads to increased plaque deposition, which in turn drives plaque aggregation and subsequent cognitive decline and neurodegeneration. Building on this literature, Mesquito et al. Used surgical, pharmacological, and transgenic models to manipulate drainage through meningeal lymphatics in order to further characterize their role in brain function, specifically in the context of normal aging and Alzheimer's disease. In their study, published in Nature, the Kipnis group at the University of Virginia pharmacologically ablated meningeal lymphatic vessels of mice by injecting a photodynamic drug capable of selectively destroying lymphatic endothelial cells. Interruption of normal meningeal lymphatic drainage impaired glymphatic exchange of CSF and interstitial solutes, suggesting the existence of a functional link between processes governing interstitial fluid, CSF exchange and CSF, lymphatic drainage. In Alzheimer's disease, the authors observed that impaired lymphatic drainage promoted amyloid beta deposition in the brain and meninges. Moreover, compromising lymphatic drainage resulted in impaired CSF brain perfusion and accompanying neurocognitive deficits. Aged population demonstrated decreased meningeal lymphatic function, which the authors postulated may contribute to features of age-associated cognitive decline. Authors noticed accumulation of waste products mainly in the hippocampus and cortex and in higher concentration in the ventricles, suggesting waste accumulation in the CSF. This finding is characteristically observed in patients with idiopathic normal pressure hydrocephalus, and is often referred to as ventricular CSF reflux. Finally, treatment of the aged with vascular endothelial growth factor C enhanced meningeal lymphatic drainage and CSF, interstitial fluid clearance, improving brain perfusion and cognitive performance. The comprehensive and elegant work by Mesquito comes at a time when several groups are attempting to increase our knowledge of these pathways and their role in neurodegenerative disease. This research provides a firm biological foundation for the potential application of neurosurgery to a broad range of age-related neurocognitive disorders than idiopathic normal pressure hydrocephalus, where CSF diversion can improve clinical outcome regardless of the directionality of dysfunction or extent of Alzheimer's disease comorbidity. Modulation of meningeal lymphatics represents a promising and novel therapeutic avenue in neurocognitive diseases. Thank you.